Let's talk about mechanical scoliosis, meaning you were told as an adult that in an x-ray you have a curvature of the spine, and usually it's a thoracolumbar junction, meaning it's when your thoracic or mid-back vertebra transition to become your low back vertebra, your lumbar vertebra. So it's the junction where the transition occurs. Usually that's where you get your little shift that they speak about in your imaging. Why does that develop? Well, presently what you'll notice is that when you sit, one of these hip joints doesn't move as well towards you versus the other. And you usually feel something in the front here. And so whether you can figure that out this way, when you hug, one comes up to you easily and one doesn't, and one pinches at the top, or they both might pinch at the top. The way that manifests in your posture, this is a flexed position. If you can sit or flex into one hip more than the other, what you'll get is, say, I can't flex into this hip as well. What your body does is slightly shift away from it. But it's so subtle. You're so used to doing it, you don't feel like you're zigzagged over. You just feel like you're sitting there and you just have a little bit of this. And you've been doing it for so long, it's not abnormal. But what happens? You're getting a little bit of shift over this way, causing that mechanical scoliosis. Now, did it start in adulthood? Probably not, because if you ever watch children, they might play like this, dirt, sand, sitting this way. Notice that shift. You might see them do this, but not as much as their favorite side, right? But we're not taught to mention anything about feeling off. We're only taught to speak about pain. Even if we mention feeling off on one side, people just kind of brush it off. So now let's take you out of single digit age, go to middle school, high school. You're probably doing this, and it's still perpetuating the curve because it feels so nice. You might do this, doesn't feel as nice, you can't do it as easily, and you'll go back to this. And you'll love this couch arm and leaning on this console and shifting towards people this way, and this one is rather ignored. In that sense, you might notice, gosh, I feel off on one side. It feels weird on one side, or you know, it might be something you mention or don't mention, but you're not gonna do anything about it because you don't have pain. Go into college, and you might start having some discomfort. Things that people start to attribute, well, you are getting older. Is it the fact that you're getting older, or the fact that you're starting to really lapse into the side? Now you have a tightened side, a loosened side, and your body's starting to compensate around that. If you were in neutral and your mechanics were normal throughout your body, would age make as much of an impact that people claim that it does? That's a question. Then you get into adulthood. Now you're tight, now you're sitting more, now muscles are really becoming overactive. And then your body starts to shift more to the periphery to make these adjustments. If you were here, it has a rotation element there. Over the years, your upper body had to shift away from that, maybe turned a little bit there. Then you'll notice in the mirror, you have like the zigzag to your neck like this, and you'll see that it sticks out more, or your shoulder height differences are bigger than they should be. When your pain began does not dictate when your issues began, because your favorite side, where you locked up one hip more than the other, started in grade school. So consider, if you're still not sure or you wonder about the scoliosis, look in the mirror and see, you know, does your neck upper level, does it stick out to one side more than the other? Does that give you TMJ issues? Is one shoulder inordinately higher than the other, and you notice you can't rotate as well on one side? Because if you were straight, you could. Those things are why you might see that in imaging as an adult but not a child. But it does have to do with how your body shifts from here up, which also influences what happens to your knee and ankles downward.